is Mental Health Awareness Month, and in today's Eye on Health, we're talking about a form of treatment for those suffering from depression.
It is called trans-cranial magnetic stimulation, or TMS, and they have it at AHN's Psychiatry and Behavioral Health Institute. So joining us is Dr. Stephen D. Forman, the medical director for AHN's Center for Psychiatric Neuromodulation, and Lori Fontanesi, a patient at AHN. This is fascinating. Thank you both for joining us and really shedding some light on this. And we're talking about the brain, so it's really interesting what can be done. Lori, talk to us about what a difference it's made in your life to start us off here.
I can't say enough wonderful words about the treatment and, of course, the people who gave it. I have had so many improvements. The first one that I noticed was the second day of treatment when I walked outside and all of the colors were so much brighter.
Wow.
Amazing. But then the other things are, I have not felt depression since. I've had a couple days where, you know, you might go, oh, this isn't the best, but nothing at all like. And I struggled with it for probably 35 plus years.
Really?
Wow.
But I felt happier. I wanted to be more social. I was not having angry outbursts at people that I have had. I've been more motivated, able to get a lot done. It's just touched every facet of my life.
And was this a situation where you had tried other treatment options?
Many.
Yeah. And this is the one that worked, and this is why you want to tell other people about it.
That's it, exactly. And I have been trying to reach people that I know may be able to use it. It's
Well, we're glad you're here to
Yes,
speak
we
out
are.
about it. And doctor, we want to find out a little bit more about it. So this generally is a treatment where other treatments haven't worked, right? Like
Correct.
you try this. So talk to us about how it does work. I know you brought something to sort of help explain.
So TMS uses short, intense magnetic pulses, sequences of them. And basically over repeated sessions, daily sessions, over 4 to 6 weeks, you basically get the brain to fire in synchrony with the pulses.
Okay.
And over time, you teach the brain to not be depressed.
Okay.
It changes the activity.
And I know Lori had mentioned
So-
she had tried several other things. I mean, who is eligible for something like this? Is this the first line treatment
So
option?
no,
Okay.
not that it couldn't work, but right now, eligibility, insurance coverage has to do with having failed a couple of courses of antidepressant treatment and psychotherapy. And if you failed and you still have severe depression, that's when you start to go for TMS. So this is actually the guts of the stimulator coil. This is where the magnetic field is generated to affect just the parts of the brain that do the most good. Patients don't actually see this part. Inside the helmets that we have some footage that I think you're showing, the helmets are nice and padded. This never touches people's actual head. It's up inside the helmet.
But you wanted to give us a peek
wanted to-
inside so that we would understand it a little bit better.
Right, it's an electromagnet. Back in junior high where you wound a wire around
Right.
a nail, well, this is the expensive version.
Okay.
So how many treatments does it take? How often? And what do they feel whenever they go through it?
Well, it's typically 20 to 30 sessions plus or minus a few extra at the end, daily, Monday through Friday, 4 to 6 weeks.
Okay.
And what it feels like, I think I could ask
Okay.
Lori to tell.
I never felt any pain. I want people to know that. There was no pain for me. What I think would explain it is somebody put something against my head that vibrated a little bit. That's it. Truly.
Some patients, depending on how much power we have to apply, it's calibrated to each patient, it can be a little bit more uncomfortable. You can have some soreness at the site and some post-treatment headache, usually for the first few sessions until patients get used to it, which most of them do fairly rapidly. But it's not acutely cutting painful or anything like that.
Right. Yeah.
I love this as an alternative option.
Well-
Yeah, for treatment, because every patient is not the same, and patients respond differently to different treatment options.
Well, and it's no meds. no sedation, no anesthesia. You're awake, you're alert. You drive in, drive home. The session itself in the chair is anywhere from 5 to 20 minutes. So you're usually in and out in half an hour. And so it's pretty nice for folks.
Yeah.
And when it works in 4 to 6 weeks.
Really fantastic to hear about this. Thank you both for joining us. Thank you, Lori, for telling your personal story. I know it's going to help a lot of other people.
And it's wonderful to see you smile.
So,
It's so bright.
you.
Yeah. And remember to keep watching for our Eye on Health series right here on PTL. It happens on Wednesdays, and it's brought to you by Highmark Blue Cross Blue Shield together with Allegheny Health Network for your health.